Hello, Lindsay Meyer here. We're going to be performing a few palpations and a range of motion, passive range of motion test on my patient's hip abduction. So, sir, I'm going to first identify a few spots on your pelvis, okay?
Okay.
All right. So, what we're going to identify first is the iliac crest. So I'm looking, right here, right on the front, for the soft sides right here. I'm going to go down to the two large bony prominences right there. Okay, so we're on the iliac crest from the anterior portion. Now you're going to turn around, turn away from me, please. Thank you. We're going to similar idea here. We're going to find the soft spot. We're going to go down until we hit those hard bony prominences. And then if I go a little bit more distal right here and medial, and my two fingers are on his posterior superior iliac spine. Right here we have that posterior iliac crest. Okay, thank you. So now we're going to move to the table, and I'm going to have you lay on your back for me. Okay? So now we're going to identify both the greater trochanter, and then we're going to do a passive range of motion hip abduction. Okay, so first thing I want to do here is identify, looking at my anterior superior iliac spine, I'm coming down, lateral hip right here, and I have a big bony prominence right here on the greater trochanter. Now to identify this, what I'm going to ask the patient to do is, could you please just put your toe out for me, let it rotate, yeah, and back in, one more time, out, and back in, good. So I feel that trochanter roll in and out of my field of right here. Okay, so we have the greater trochanter. Now we're going to, from here, we're going to take a passive range of motion measurement on his hip abduction. So first what I'd like to do is just see how it feels. So we're going to have the patient kick out to the side. I'm going to kind of help you. Make sure your toe stays nice and straight. I feel right here. And a nice firm end feel with that hip. Good, now bring it back. Good. Now I was identifying the ASIS right here to make sure I had the right joint. So from here, I did the same exact thing. I'm going to line up the goni. So the goniometer is going to be right on top of that ASIS with the arm facing the other ASIS. And then my movable arm is going to be straight down the femur facing towards the patella. So what we're going to do is I'm going to move your leg out. Let me have it. Toes stay straight up as far as we can comfortably so get a nice good feel. Right there. And from here I'm just adjusting my goniometer. Very good. Making sure you're nice and lined up. And we're lined up. Good. And we're going to slowly bring that back. Thank you. All right. And we got just 36 degrees of hip abduction passive range of motion. Thank you.